Namaste, this is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we will be talking about indigestion. So, indigestion, simply put, is pain or discomfort in the abdomen after eating. We all have experienced varying degrees of indigestion several times in our life. However, in some people, they experience these symptoms repeatedly, irrespective of any known cause or dietetic errors. So, let's see what are the symptoms of indigestion. Pain in the abdomen, especially after eating, burning in the abdomen or burning behind the chest after eating, feeling bloated or feeling full immediately after having a few morsels. So, for example, while they feel hungry and they sit to eat, immediately after eating only a little food, they feel as if their stomach has distended. These are all the main symptoms of indigestion. Apart from that, burping, passing gases, the stomach feeling bloated, and regurgitation of food, which means that while they are burping, they will end up bringing in their mouth the food that they have swallowed an hour or two back. So, these are common symptoms of indigestion. The burning in the chest, which comes with indigestion, is similar to the symptoms we will get during a heart attack. So, sometimes it will mimic like a heart attack. So, whenever we get a call saying that there is pain and burning in the chest, we try to differentiate whether this is indigestion or a cardiac problem. So, what happens in a cardiac problem is, along with burning in the chest, they will also get pain in the chest, which is squeezing or tightening pain. There is sweat along with this complaint, plus the pain will aggravate on motion. Whenever they walk or they will climb steps, the pain will aggravate, and this is how we will differentiate from indigestion and cardiac problem. So, these are the common symptoms of indigestion. Let us see the commonest causes of indigestion. First and foremost, the most commonest cause are dietary error. It means that you are having the wrong food at the wrong place. The commonest example is junk food or having food on the road, because many times the food that we eat on the road is fried multiple times. So it has huge amount of oil plus bad fats. So this causes increased acidity. Second is eating at a irregular time. Third, eating a heavy meal at the wrong time, which means eating a good meal very late in the night will also cause the stomach to distend. There will be pain and symptoms will be experienced. Again, if you have your food very fast because you are in a hurry, that will also cause discomfort to you. Second cause of indigestion is stress. We have earlier mentioned in our videos that people who tend to become more anxious or more angry will always have increased acid secretion in the stomach. We know that the mind and the stomach, mind and the intestines are closely related. A little stress in the mind is enough to cause acidic symptoms. So, people who are prone to prolonged anxiety usually complain of hyperacidity. Third is increased acid secretion. Now, in our stomach, there are cells lining the stomach. A bunch of cells will secrete the acid which is present in the stomach, and the other lot of cells will create the mucus which will line the inside of the stomach. So, whenever the food is eaten and the acid is secreted in the stomach, the acid does not trouble stomach itself. So, there is a coating of mucus. However, when there is increase in acid secretion, sometimes even the coating wears out, and so the acid which is produced in the stomach to digest food starts troubling stomach itself. This is when we experience burning in the stomach and pain after eating. So the foods which will cause increase in acidity are main cause for this. The next is increased intake of caffeine, your coffee, smoking, that is nicotine, and alcohol. Alcohol itself is an acid, so it's like drinking an acid. All these are going to cause increased acidity. So let's see what is the treatment of indigestion. Here, like any other disease, we will separate this into two parts. First is a lifestyle modification or dietary modification, and second is homeopathic medicines. Medicines alone will not help unless you are ready to make changes in your eating patterns. So, first and foremost is to avoid outside food, avoid your junk food, avoidance of oily food, and highly spicy or seasoned food, as all this will contribute to increased acid secretion in the stomach. Drinking plenty of water, having regular meal times. Your body clock is adjusted such that whenever it is the time for you to eat, the acid secretion has begun in the stomach. So whenever you skip your meals or don't eat for a prolonged period of time, the acid remains in the stomach, and that is when you get the burning sensation. So it is very important to have your meals on time. Avoid eating late in the night. If you have got late for your dinner, you should skip full dinner and have only a little of it, so that it does not come up later or there is no regurgitation once you lie down. Avoid lying down for 1 hour after having your meal. Take a good sleep, exercise regularly, as it ensures good motility of your intestines. Avoidance of alcohol, coffee, nicotine, that is smoking, is absolutely important, as all of this will increase the acid secretion in the stomach in the long run. Second is homeopathic medicines. Now in homeopathy, we have discussed here that prolonged anxiety and angry temperaments are more prone to indigestion troubles. So a detailed history is taken. We see their sensitivity patterns as to what they are sensitive, what makes them angry, and what symptoms are experienced in the stomach. For example, some may have pain in the upper abdomen, some may have pain in the lower abdomen. For others, the pain may be more after a breakfast. For others, the pain may be more after lunch. In a few people, the pain gets better when they lie down. In a few, the pain gets better when they start walking. All these are important symptoms for us to know, because they will tell us the mind-body correlation, that the stress in the mind is affecting the stomach in this certain way. Accordingly, a medicine is prescribed. And let me tell you friends, patients respond to treatment much earlier than they own expect. However, for the effect of the treatment to be good and lasting, dietary modifications have to be followed. And this is how indigestion is quite easily treated with homeopathy. I have recently published a book on homeopathic medicines, that is Unlocking the Bogle Synoptic Key, Part 1. It is available on Amazon. I am currently practicing in Dadar West Shivaji Park area. My clinic timings are afternoon 1 to evening 7 pm. On Mondays, Wednesdays and Fridays, I practice at Park Polyclinic 5 Shankar Nivas, Dada Saheb Rege Marg. On Tuesdays, Thursdays and Saturdays, I practice in Sapres Polyclinic, Malik Building, D.V. Deshpande Marg, Shivaji Park, Road number 4. You can also follow me on YouTube, Facebook and Instagram. Stay happy, stay blessed. Thank you.